How do we define hypertension? In 2017, the American College of Cardiology and the American Heart Association recommended an updated hypertension staging system based on measured blood pressure. For adults, normal systolic blood pressure is less than 120 millimeters of mercury, and diastolic blood pressure is less than 80 millimeters of mercury. Blood pressure is considered elevated if systolic blood pressure is between 120 to 129 and diastolic blood pressure is less than 80. Stage 1 hypertension is a systolic blood pressure of 130 to 139 or a diastolic blood pressure of 80 to 89. Stage 2 hypertension is a systolic blood pressure of greater than or equal to 140 or a diastolic blood pressure of greater than or equal to 90. How prevalent is hypertension in U.S. adults? Nearly 50% of U.S. adults have stage 1 or stage 2 hypertension. That's 120 million people. This includes 50% of men and 46% of women. Hypertension prevalence increases as we age. About 26% of 18 to 44-year-olds have hypertension. This increases to about 60% in 45 to 64-year-olds and is nearly 80% in those 65 and older. Uncontrolled hypertension can result in serious health issues, including dysfunction in a number of organs, which can lead to increased morbidity and mortality. Negative effects of hypertension include left ventricular hypertrophy, heart failure, ischemic heart disease, ischemic stroke, intracerebral hemorrhage, chronic kidney disease, and end-stage kidney disease and sexual dysfunction. An increase in systolic blood pressure of 20 millimeters of mercury and 10 millimeters of mercury in diastolic blood pressure can lead to a doubling in the risk of death from heart disease and stroke. So how do we manage hypertension? All people with hypertension receive a recommendation for lifestyle changes. The largest potential impact on systolic blood pressure is from adopting the DASH diet, a healthy diet of fruits, vegetables, whole grains, and low-fat dairy, and lean protein. Other impactful changes include aerobic physical activity, reduced intake of dietary sodium, weight loss, enhanced intake of dietary potassium, and moderation of alcohol intake. About 80% of patients with hypertension are prescribed a blood pressure medicine. Many of these recommendations are based on findings from clinical trials. In particular, the antihypertensive and lipid-lowering treatment to prevent heart attack trial, commonly referred to as the ALLHAT trial, which was published over 20 years ago in 2002. The most common and effective classes of drugs utilized are thiazide-type diuretics, calcium channel blockers, ACE inhibitors, and angiotensin II receptor blockers. Determining which drug and drug class to use can be influenced by a patient's comorbidities, such as coronary artery disease, heart failure, diabetes, and chronic kidney disease. Importantly, the primary factor in reducing cardiovascular risk from hypertension is the degree of blood pressure reduction rather than the specific drug used. The goal of lifestyle or medication is to reduce blood pressure below 130/80. It is not uncommon for patients to need a combination of drugs from different classes in order to achieve blood pressure control, particularly in patients with systolic blood pressure 15 millimeters of mercury or more above goal. So, how successful are our approaches to lowering blood pressure? Unfortunately, 72% of those receiving recommended medication and lifestyle modification have uncontrolled hypertension. That's 68 million people. Considering the health risk associated with elevated blood pressure, it's important for people to have their blood pressure checked regularly, implement lifestyle changes, take medications as prescribed, and talk with their medical providers regarding barriers to successful hypertension control.